Welcome to Medial Atlas. In today's video, we are going to talk about a very important LAQ from upper limb, that is ulnar nerve. Let us start with the topic, ulnar nerve. So this ulnar nerve, it runs on the medial side or the ulnar side of the upper limb, and its origin is from the medial cord of brachial plexus, and its root value is C8 and T1. Occasionally, remember, C7 is also participated. Next, what is the course of ulnar nerve? So ulnar nerve in axilla, it lies between axillary artery and axillary vein. So in the axilla, it is very deep and it lies between axillary artery and axillary vein. And in the arm, the course of ulnar nerve can be studied under three headings, or the subheadings, that in the upper arm, in the middle arm, as well as in the lower arm. So in the upper arm, that is the anterior compartment, the ulnar nerve, it lies medial to the brachial artery, whereas in the middle of the arm, the ulnar nerve, it pierces the intermuscular septum and enters the posterior compartment. So in the lower arm, that is in the posterior compartment, it lies back of the medial epicondyle. And one more important point to note here is ulnar nerve is not a content of cubital fossa. Okay, it just lies behind the medial epicondyle. Now in the forearm, like from the medial epicondyle, from the back of the medial epicondyle, the ulnar nerve, it enters the forearm by passing between the two heads of flexor carpi ulnaris muscle. Okay, in the lower of the forearm, the lower part of the forearm, this ulnar nerve, it is accompanied by ulnar artery. Next, in the wrist, the ulnar nerve, it passes superficially through the flexor retinaculum, that is, it passes through the Guyon's canal. In the hand, it is divided into two branches, that is superficial and deep. The superficial branch is a sensory branch and a deep branch is the motor branch, and this deep branch, it supplies the muscles of hand. Not all the muscles of hand, most of the muscles of hand. We'll be discussing the muscles of hand also in a separate video. Next, let us look at the course of ulnar nerve again in this like the atlas diagram. So as discussed, ulnar nerve, it originates from the medial cord of the brachial plexus. In the arm, it can be studied under the three headings, upper, middle and lower. In the upper part of the arm, the ulnar nerve is in the anterior compartment, that is in the anterior compartment, and in the middle, it pierces the intermuscular septum. At the lower, it enters the posterior compartment, and posterior compartment behind the medial epicondyle. From the posterior compartment, it enters the forearm, passing between the two heads of flexor carpi ulnaris muscle. Okay, this is the flexor carpi ulnaris muscle. It passes, look here, it passes between the two heads of flexor carpi ulnaris and enters the forearm. And at the lower part of forearm, the ulnar nerve, it is accompanied by ulnar artery, and this, it passes superficial to the flexor retinaculum. In the hand, it divides into superficial and deep branches and provide the sensory as well as the motor supply. Now let us talk about the branches of ulnar artery. When we talk about the branches, let us try to understand the branches in a schematic diagram, and please try to represent the same schematic diagram in the exam for more marks. Okay, now in the axilla, there are no branches for ulnar nerve, whereas in the arm, it gives a branch to elbow joint. In the forearm, as it passes between the two heads of flexor carpi ulnaris, obviously there is a branch for flexor carpi ulnaris. Next, this is somewhat important. Okay, it supplies flexor digitorum profundus, but not the whole muscle, only the medial half. Okay, only the medial half of flexor digitorum profundus is supplied by ulnar nerve, whereas the lateral half, it is supplied by anterior interosseous nerve, which is a branch of median nerve. Okay, remember, only the medial half is supplied by the ulnar nerve, whereas the lateral half, it is supplied by median nerve. Okay, that is the anterior interosseous nerve. Okay, as well as it also gives palmar cutaneous branch, and this palmar cutaneous branch, it supplies only the medial 1/3 of the palm. Okay, and it gives one more branch called as dorsal cutaneous branch. Okay, palmar cutaneous branch, dorsal cutaneous branch. palmar cutaneous branch, it supplies medial 1/3 of the palm, whereas this dorsal cutaneous branch, it supplies the skin of the medial 1/3 of dorsum of hand. Okay, skin of the dorsum of hand, and it also supplies the medial 1.5 digits. Remember, palmar cutaneous branch supplies medial 1/3 of palm, whereas dorsal cutaneous branch, it supplies medial 1/3 of dorsum of hand, that is skin of dorsum of hand, as well as the medial 1.5 digits. Okay, and it also gives a branch to wrist joint. Next, this is somewhat important. It gives the nerve supply, the nerves in the hand. Like in the hand, it supplies the muscles. What muscles do the ulnar nerve supply? So the muscles of hypothenar eminence. Try to remember the muscles of hypothenar eminence. Okay. Next, it supplies adductor pollicis, and it also supplies third and fourth lumbricals, and it gives branch to palmar interossei, dorsal interossei, and palmar digital branches to skin also, as well as one more important branch, that is palmaris brevis. Try to remember muscles of hypothenar eminence, adductor pollicis, third and fourth lumbricals, palmar, dorsal interossei, and palmaris brevis. When we talk about muscles of hand, we'll be discussing about this again. Okay, don't worry, we'll be discussing about this again. But if you have any doubts, please do comment in the comment section. So once again, in the hand, it supplies the muscles of hand. Okay, it supplies the muscles of hypothenar eminence, adductor pollicis, third and fourth lumbricals, palmar and dorsal interossei, and palmaris brevis. Okay, try to remember, guys. Do practice the diagrams, like schematic diagrams, and try to revise. Okay, now the important part, the clinical anatomy. So clinical anatomy of ulnar nerve can be studied under two headings. One is the lesion at the level of elbow, and another is the lesion at the level of wrist. First, ulnar nerve injury at the level of elbow. What are the causes of the ulnar nerve injury at the level of elbow? Are fracture of medial epicondyle and cubital tunnel syndrome. So these are the two causes. What are the features? So there will be paralysis of flexor carpi ulnaris and medial side of the flexor digitorum profundus, as well as there is the flattened medial border of forearm. Okay, and when we attempt to produce flexion at wrist, it causes abduction of hand. Okay, so when we attempt to produce flexion at wrist, it causes abduction of hand. So that is simply, it has weak wrist flexion, and there will be radial deviation of hand. In simple words, you can write this in exam, this point: weak wrist flexion with radial deviation. And there is also sensory loss in ulnar side of 1.5 fingers. So this is the features at the level of elbow. If the injury is at the level of elbow, come on, repeat it with me, guys. So there will be paralysis of flexor carpi ulnaris and medial side of flexor digitorum profundus with flattened medial border of forearm with weak wrist flexion and radial deviation, and sensory loss in ulnar side of 1.5 fingers. Next, this is somewhat important: ulnar nerve lesion at the level of wrist. So what can be the cause? The cause can be the compression in Gaines canal. What are the features? So if there is a lesion at the level of wrist, so this produces an ulnar claw hand, okay, or spinster claw hand. So what are the features of this ulnar claw hand or the spinster claw hand? Are motor loss. What motor loss? So there will be hyperextension at metacarpophalangeal joints. Remember this: hyperextension at metacarpophalangeal joints and flexion at interphalangeal joints. Okay, imagine in your hand, locate the metacarpophalangeal joint as well as the interphalangeal joint. Okay, there will be hyperextension at metacarpophalangeal joints and flexion at interphalangeal joints. Wait, I'll try to show you this metacarpophalangeal as well as the interphalangeal joints. We have discussed this in the previous video, so I'll just try to show you guys. Mm, yeah. So there will be what we have discussed. There will be hyperextension at metacarpophalangeal joints. So here there are metacarpals, right? So these are phalanges. So there is hyperextension at metacarpophalangeal joints, and there will be flexion at interphalangeals. So this is one phalange and this one phalange. So there will be joint here. So the hyperextension at metacarpophalangeal joints and extension at interphalangeal joints. So this is a typical clinical feature of the claw hand. Now the next one is the ulnar paradox. So this ulnar paradox can be asked as an MCQ. Okay, so this ulnar paradox, what is this ulnar paradox? If the lesion is at higher level, that is at the elbow, there will be less clawing of hand. Okay, now if the lesion is at the lower level, there will be more clawing. Simple. Okay, suppose as discussed, lesion at the higher level at the elbow means there will be less clawing. If the lesion at the lower level, that is at the wrist, it causes more clawing. That is the ulnar paradox. Okay, now along with motor loss, there will be sensory loss also. Now this sensory loss is noticed at the medial 1/3 of palmar and dorsal surfaces of medial 1.5 fingers, and including all nail beds. So in exam, if you can't remember all these things, the medial 1/3 or medial 1.5, simple trick, just write this line. There will be sensory loss on the palmar and dorsal surfaces of ulnar side. Remember, you can apply any you can apply, like you can remove ulnar and you can replace median. You can you can replace with radial also. So simple line is sensory loss at the palmar and dorsal surfaces of ulnar side. If you can't remember these things, if you can remember, definitely you can write, you can score good score. Okay, and there also be vasomotor and trophic changes. What are vasomotor? So there will be arteriolar changes. So you get the hand feels warm, and trophic changes, if the lesion is long standing, there will be scary nail beds or the easy breaking of nails. So this is all about ulnar. Now if you have any doubts, please do comment in the comment section. Do follow us on Instagram and Telegram. If you have any doubts, you can contact us on the Instagram also, and please do like, share and subscribe. Thank you.